So a little bit about this tumour. So the name of it is a chondroblastoma. So it's a type of bone tumour that is derived from cartilage cells. There are two types of bone tumour. You've got a benign bone tumour, which is non-cancerous. So this is what the chondroblastoma is, a non-cancerous bone tumour derived from cartilage cells. And then also you've got bone tumours that are of a cancerous nature. Then if you break down bone tumours into two other subtypes, you've got blastic tumours or blastic bone tumours. So blastic is where the body produces kind of immature weak bone within the tumour. And then you've got lytic tumours. So this is where it destroys the bone as the tumour is growing. So a chondroblastoma is a benign tumour of a lytic nature. They're quite commonly seen in long bones, growth plates, shoulder areas, knees and hips. With mine, it's in the pelvic area on the right side in the anterior column. So what that means is in the front portion of the pelvis going into the hip joint. So the surgery that I'll be having to remove this is what's called an Intra Hemipelvectomy. This is where they remove the section of the bone, creating a big enough margin around it so it removes the tumour in its entirety. Surgeries that I've had previously, so a fairly minor one in 2013 where they just scraped the tumour out, which obviously there was a risk by leaving some of the cells in there, and then in the 2018 it grew back again. Fairly major surgery this time, but still some of the cells were left there and there was a chance that it would come back, which it has. So this surgery is hopefully going to get rid of it all by removing that front portion of the pelvis. So it's quite severe. The type of surgery, as I mentioned, is Intra Hemipelvectomy. So if you have a look at this picture here in the top corner, it's going to be between a kind of type 2 and type 3, moving that portion of the pelvis, and they're going to be putting in something that's going to look similar to that there, which is made out of titanium. So removing the pelvis or any part of the pelvis is quite a big surgery. It's the foundation of your body. It's a very vital part of movement, of support, structure. Your legs attached to it. You've got lots of muscle attachments. It's very closely linked to all your internal organs. So it's a big surgery. It's going to last anything between 6 to 10 hours. I'll be in hospital for 2 to 3 weeks after that. And then recovery wise, we're not too sure. 3 months we know it's going to be partial weight bearing, and within 6 months I should be feeling a bit more human, was the consultant's words, and then full recovery to whatever capacity that is likely to be 12 months. At the moment we're not too sure. I'm focusing most of my energy on the present moment now, enjoying everything that's going on and just focusing on the first step, which is get through the surgery and start the process of healing. But the reason why I'm doing these videos is because I know it can be a lonely time when people are going through things like this. I definitely felt that in 2018. So the hope of these videos is just to shed some light on the topic. So if anyone is going through something similar, they know they're not alone. If you know anyone going through something like this, please do share this video with them, because the hope and the purpose of these videos is just to help people. Thank you for listening, and I'll see you soon.